Good afternoon, everyone, and welcome to this month's webinar entitled From Lecture Halls to Clinics, Dermatology in a Changing Medical Landscape, held in celebration of the UP College of Medicine's 120th founding year. We are tuned in today to celebrate 120 years of excellence, innovation, and leadership. This milestone reminds us not only of our rich history, but also of our shared commitment to adapt and thrive in an ever-evolving healthcare landscape. In this session, we will explore how dermatology education has transformed, shaping future physicians through creativity, resilience, and a deep sense of purpose. To officially open today's program, may we call on the founding chair of the UP-PGH Department of Dermatology, Dr. Eileen Liesel Cabillan, for her welcome and opening remarks.
Good noon, everyone. And first and foremost, I'd like to greet our alma mater of happy 120th anniversary. Now, the Department of Dermatology is the youngest clinical department of the college, being its 21st clinical department. The elevation from division under the Department of Medicine into an independent department happened in February 3, 2020. And we were very grateful, especially to our beloved Dean, Charlotte Chong, for making this happen during her term. Although we are just 5 years as a department, our roots go back more than a century. UP Dermatology was established in 1922, and we celebrated our centennial and our grand homecoming just in 2023. And we are it proudly stands 103 years strong. So in the next hour, we are excited to introduce you to our department, share our current work, and give you a glimpse of what we're headed. So again, welcome everyone and happy anniversary to the UP College of Medicine. So back to you, Tin.
Thank you, Dr. Cabillan, for that warm welcome. Next, we have a segment that takes us on a journey through time, a storytelling session entitled From Lecture Halls to Clinics, Dermatology in a Changing Medical Landscape. In this presentation, our very own Dr. Clarita Corazon Maaño, former chair of the Section of Dermatology and currently Professor Emeritus at UP College of Medicine, will walk us through the remarkable transformation of dermatology education in our college, from the early days of traditional lectures to the dynamic, patient-centered, and technology-enhanced strategies we embrace today. She will share milestones, innovations, and the creative approaches that have shaped how our students learn, turning dermatology into not just a subject, but a truly immersive experience.
Hello. Hello.
Ma'am Clary, you may begin na po.
Oh no.
Dr. Maanyo will just share the screen for you, then tell us when to move slides, okay? You may unmute na po, ma'am, and begin your presentation.
Yes, can you do that? Sige. I can not move the slides kasi it's not moving. Okay. So I'm so sorry about the slides, no? Can we move it now? Okay, change slide, please. So this first slide shows a dermatology education is like medical education. It starts from the undergrads to the internship, and then you take your physician's board examination, certifying examination, up to the time you either become a public health practitioner or a specialist. It is indeed a lifelong learning, a lifelong commitment, which is an integral part of the physician's career. We do not stop at what we are learning, otherwise we become stagnant. Next slide, please. That's the reason why we had this specific theme from lecture halls to clinics, dermatology in a changing medical landscape. Let me share with you the evolution of medical education. And I would like to thank Dr. Coralie Di Macali for sharing me this slide. Way back in 1905, Act number 1415, the Philippine Commission of the US government established the Philippine Medical School. And it was opened in 1907. And in 1910, Flexner emphasized the structure science of having a curriculum offering 2 years of basic sciences and 2 years of clinical sciences. And then in 1923, the Philippine Medical Education was renamed University of the Philippines College of Medicine. In 1922, the lectures on dermatology was started by the internist interested in teaching about the skin. We had at that time Dr. Um, Pablo, Dr. Manuel Fernandez Sr., Dr. Pablo Campos, and Dr. Perpetua Gutierrez. The UPCM was ranked as a Class A medical school at the time by the American medical colleges and made a full-fledged member. In 1946, the UPCM became an affiliate member of the AAMC, and in 1967 became a founding association of the Philippine Medical College, or the APMC, wherein we are also a member. In 1969, we started the 4-year traditional curriculum with postgraduate internship. And in the 70s, we started to innovate the SPICES model of the curriculum with the problem-based learning and community-oriented workshops conducted by the faculty. In 1982, the Intermed program was started, and in here we made our first lecture in the 5th year level of the Intermed, or the 3rd year medicine proper. Next slide, please. In 2004, the implementation of the organ systems integration medical curriculum was started. We started our lectures starting from level 3 to levels 5 of the intermed level, with the 6 and 7 being an optional and elective choice. Dermatology at that time was offered from 1st year medicine proper to 3rd year medicine proper. Next slide, please. This is the old main entrance of the Philippine General Hospital, Manila, in October 1947. This was our host hospital, wherein we see cases also at that time. Next slide, please. So this is the old OPD, which we had. And in the old OPD, we see at least one of the dermatological cases, and this was discussed by our year level 5 students. third year medicine proper. Next slide, please. This is the old pharmacy where we had during our clerkship. We were already taught how to do the prescriptions with guidance of our resident at the time. We had prescriptions coming from the pharmacy itself, anti-scabies, anti-lice preparation, potassium permanganate, etc. Next slide, please. So our goal is to teach the students to inculcate dermatology in the various year levels. And to do this, we have to create an instructional design in inculcating dermatology in the medical curriculum. So how do we do this? Next slide, please. The goal of what to teach is dependent upon the community, the people, the patients who dictate the needs. And it is also dependent upon the community who also dictate the needs. And next slide, the medical students in the community and barangays also need more efforts to be trained in skin diseases and concerns. Next slide, please. So we also looked at our research that we did in 2015 to 2019, wherein we looked at the general medicine OPD cases and saw that in every one was a dermatologic case for every 4 general medicine OPD case. Next slide, please. We also looked at our country scenario wherein we saw the national capital region with the most number of dermatologists. Next slide, please. We also looked at the Philippine Dermatological Society Health Information System, wherein the most common diseases contributed by the various training institutions were recorded. We had dermatophytosis, acne, scabies, sebderm, contact dermatitis, atopic dermatitis, lichen simplex chronicus, verruca vulgaris, contact dermatitis, and psoriasis. These were what is important for us because these are the ones that we're going to teach the undergrads. We started to plan and position our different slide cases. Next slide, please. So, next slide, please. Preparing the photos and slides, because as you very well know, dermatology is a visual field. So checking the teaching slides and digitalizing them on the computers were done. Next slide, please. So we started with year level 3. The course is OSI 203 with the module on skin, muscles, and bones, the first year medical proper, wherein, as you well know, in the very beginning, when you read, we say you do the ABC, and when you sing the do, re, mi, in dermatology, we start with the normal skin and its aberration, the macule, the papule, next slide, the vesicle, the pustule, the plaque, and the nodule. Next slide, please. So when we come up, when we go up the ladder, come up with the various diagnostic impression, this started in the year level 4 together with history taking and physical examination. We look at the signs and symptoms of itch, pain, erythema, inflammation, dryness, whipping lesions, and excoriations. Okay, as they move through this ladder of 4 and 5, like this, they have the erosions, the scars, atrophy, and ulcers. Next slide, please. Next slide, please. These are the students that we had in year level 3 or the first year medicine proper. There are 160 of them. So what we did is to divide them into groups of 10 to 12 with band by a resident per each year level, and with a consultant in front who is flashing the slides on to the students. And then they will ask, what is it in the history that you would like to ask? What do you see? What are the distribution of the lesions, etc. No? Next slide, please. And as we always tell them, the best light would be sunlight. So you have to go nearer our windows for you to see best the lights, best the lesions that you are looking at. No? Next slide, please. So these are the SGD group of our consultants. This is now in the new building of the Henry C. Well, we did before also SGDs in the old medicine building. No? These are also group discussions with medical students, with a patient there. Okay, next slide, please. Next slide, please. And these are also LU5 medical students with our consultant, Dr. Fres and Dr. May. Next slide, please. So we advanced through the years of year level 4, that is dermatology modules, lecturing on general symptomatology, diagnosis, and treatment, and year level 5, integrated clinical clerkship in dermatology of common dermatological conditions in the ambulatory setting. Next slide, please. We also made dermatology self-instructional modules for them, okay? Like, for example, this one. This is this will help us especially in areas where there are, during the COVID period, or there are times when there are storms and there are no classes. Next slide, please. Next slide, please. And these are year level 6 and 7 also having their electives in dermatology. They can go to the wards with our residents or go CER skin cases also with the residents. Next slide, please. Next slide, please. Okay, this is still our electives of 6 and 7. Next slides. Next slide, please. Assessment is done by written examination of the students. This is now in the Benefe Auditorium. We also did a Kodachrome Viva, also as a part of their examination. And also, we also did OSCE, Objective Structured Clinical Examination. Now, this will depend on what year level we are examining. If it is year level 3, we only expect them to do history taking and a description of aberrations of the skin. Now, if it is year level 4, then we expect them to do an impression and the diagnostic procedures that they can ask for. And if it's year level 5, they now go to management and patients education besides diagnosis and treatment. This is an intern doing OSCE to the students. Now, the students learn and contribute to their base hospital by lecturing also, PGH, and during their community rotation. The students train imparts knowledge and proper attitudes towards patients and relatives on skin care through public health lectures, whether in PGH or in other areas. Our year level 5 students had also made videos of warning signs, like, for example, warning signs of melanoma, etc. No? Next slide, please. Next slide. And after finishing their undergraduate years, it's now their graduation time and become future physicians. But we don't know who of them will go to dermatology and who of them will be public health physicians or stay in the community. Next slide, please. Like, for example, here, stay in the community and they are knowledgeable, expect them to be knowledgeable already in dermatology. Next slide. Next slide. So some of them may choose residency training. And if they do, there is a wide range of dermatological cases seen in the community and in the hospital in our OPD for them to learn and impact patients' education with clear and understandable instructions. Next slide, please. And they also made use of our DermPath microscope. At that time, we only had, I think, about 8-headed microscope, no, at that time. Next slide, please. Or they go to the wards also, learn skin concerns, getting a better and closer look, practicing and demonstrating knowledge, skills, and proper attitudes when they see patients also in the wards. Or they can do the early surgical pig skin, suturing, and learning how to do their lectures. Next slide, please. Early recognition of surgical cases, they can also do that at an early stage. And if we don't have patients, we can make use of our modules, models, or our frames. Next slide, please. And these are the dermatology faculty learn from each other's cases before we discuss the cases. Next slide, please. These are our residents at the time who are now future consultants. Next slide, please. And after finishing their residency period, they can now take their board exam and the PDS diplomates, and 2 years after which they become fellows. We are proud that all of our residents had passed the Philippine Dermatological Society exam, and some of them even make it to the top. After having their diplomate exams, they can now move to serve the community. This is an example of the Bigay Puso na community service. The same with this community service in Tala. Next slide, please. Again, our dermatology consultants before, faculty consultants of dermatology after. Okay, next slide, please. The product is an increased student-friendly faculty, features of dermatology inculcated in medical education, mentors of the residents and students in dermatology. Next slide. So what's our current impact and future directions? We have, next slide, please. We have our Atlas of Philippine Dermatology. Way back in 2014, this was awarded as as an outstanding book award given by the National Academy of Science and Technology, and we also contributed those to our library. These are our common dermatosis in the ambulatory setting, which we had revised in our second edition of the Atlas of Philippine Dermatology. Next slide. So if there are, we can also learn on online teaching via Zooms by this one. Okay, next slide, please, which can reach the provinces, or learn outside the country and contribute or echo them what we had learned to our department. Next slide. We share and learn outside the country. Next slide, please. Right. Next slide, please. Okay. We are also close to our university healthcare with our chairman here in dermatology, sharing universal healthcare with our community. Like for example, these brochures on Kuto. Next slide, please. Okay, and how they are both in the Filipino dialect, etc. No, so continuous leadership and innovation in medical education is very important. We participate in all of this. And it's not just lifelong learning, but also lifelong service and continuous research innovations for more ways of serving our community. The pamana, agham, kalinangan, at pagdamay. Thank you very much. Thank you. We have another slide for this, but then this is a different slide. Okay, next slide, please. I think that ends my talk. Tin, thank you very much.
Thank you, Dr. Maanyo, for that rich and insightful presentation. You've given us a meaningful look at how dermatology education has grown at the UP College of Medicine and adapted over the years. A true testament to the commitment of our department to excellence and innovation. We now move to our panel segment, an interactive discussion on innovations and the expanding frontiers of dermatology education. We'll be touching on service, research, training, and a glimpse into the future of our specialty. Joining us for this engaging exchange are our very own faculty members at the Department of Dermatology, Dr. Dayan Paras for Community, Dr. Belen Dufitas for Research, and Dr. Eileen Cubillan for Training. Welcome, doctors and fellow faculty members. Welcome, everyone. Let's start with community service. Dr. Paras, please walk us through some of the recent community projects of the department, Sinag, Aruga, and Tutok Buhok, and tell us how they came about.
Good day, Doctors Batak, Doctors Maanyo, Cobillan, and Dufitas, and good day to everyone. Happy 120th founding anniversary to our beloved UP College of Medicine. I'm Dr. Dayan Paras from UPCM class of 2016. This photo was taken back in 2011 in the old BSLR East when we were in LU3. This picture, you can spot 5 future UPPGH dermatology alumni. That's me in front, leftmost, Two rows behind, from left to right, are Dr. Shahara Abalos, Sarah Obus, Doha Manalo, and Sel Gonzalez. By this time, we had already completed our OS-203 dermatology rotation. You can tell from our uniforms. Back then, the very first time we wore our white uniforms was for the for the dermatology OSCE, the moment that made it all feel real. We also had just finished our discussion on bakit nga ba namatay si Rosario. It's hard to believe it's been almost a decade since we graduated. But those early conversations on the social determinants of health, scheduled just a few days into our UPCM journey, still resonates deeply. It was more than just a discussion, it was a call, a glimpse into the challenges we were preparing to face as future physicians. Later on, I came to understand we weren't being called merely to treat the sick. We were being called to help heal a very sick nation. Because as we navigate an ever evolving healthcare landscape, practicing dermatology within and beyond PGH, one fundamental principle endures: health is a right. Access to quality healthcare is a basic human right. And that's one of the very first lessons I remember learning at UPCM. And as UP-PGH alumni, we cannot and must not turn a blind eye to how this right is continually denied to many of our fellow Filipinos by our very own government. That is why community service is and always has been at the heart of what we do in UPCM, in the Department of Dermatology, and even beyond the halls of PGH. The training we received molded us the dermatologist into dermatologists with a deep and abiding sense of service. Aruga, Sinag, and Tutok Buhok Hair Donation Drive represent some of our most recent community-driven initiatives, each one reflecting the unique advocacy and commitment of our residents. Aruga was launched during Dr. Maan Atienza's senior year, focusing on providing compassionate dermatologic care to underserved communities. Sinag was inspired by Dr. Gerson Takibau's passion for skin cancer prevention, promoting awareness and early detection through community education and outreach. And the Tutok Buhok Hair Donation Drive was initiated during the senior year of Dr. Denise David and has been continued this year by Dr. Isa Silor. This project supports patients with alopecia through donated wigs made from hair donations, along with awareness campaigns. Dr. Batak and I have had the privilege of supervising these remarkable dermatology residents, each one exemplifying the spirit of service we hold dear. So let's go to Aruga. We acknowledge that medical missions can sometimes feel like a band-aid solution. Ideally, if our healthcare system were truly accessible and equitable, the need for such missions would diminish. But while we continue to advocate for improvement in our healthcare system, we remain committed to reaching out to our underserved fellow Filipinos in the meantime. Since 2023, the centerpiece of Aruga has been our annual dermatological surgery mission. Each year, we select a town in the provinces where we provide free ambulatory dermatologic surgeries such as excisions of lipomas, acrocordons, and follicular infundibular cysts, among others. In 2023, we partnered with the LGU of Muñoz Nueva Ecija and last year with San Jose Nueva Ecija. And in both missions, we were able to perform skin biopsies on suspected basal cell carcinomas. And the earlier case has already been successfully treated with most micrographic surgery at our very own most surgery unit in the OPD and is now cancer-free. This meaningful outcome underscores the value of our missions and brings us to the next chapter of our work, CNAG. Skin cancer is the most common type of cancer. From 2011 to 2021, PDS documented more than 2,000 BCCs and more than 600 SCCs. Though these numbers are likely underestimations due to the absence of a national cancer registry. With over 34% of Filipinos working outdoors in agriculture, forestry, fishing, and construction, many are at higher risk, yet often seek care late due to the barriers in our healthcare system. And because skin cancer is preventable, we launched an ongoing campaign to educate farmers, MMDA officers, and the general public on protecting their skin from UV exposure, which is the leading risk factor for skin cancer. These campaigns include educational lectures and the distribution of sun protection kits such as sunscreen, sun sleeves, and sunglasses. And lastly, our Tutok Buhok. This community project reminds us that we don't always need to travel to far-flung areas to serve. Sometimes the gap is right in front of us, simply waiting to be filled. Through this initiative, we offer psychosocial support to patients suffering from alopecia, and we also conduct hair donation drives to provide free wigs, helping restore their self-esteem and confidence. Such as this patient who was one of the recipients last year, she has been living with alopecia areata universalis. Our community work began long before I joined the department under the leadership of Dr. Roa, Dr. De Fitas, and Dr. Batak. Their dedication laid the foundation for what would eventually become Aruga, our umbrella initiative for all the dermatological missions conducted throughout the year. Until the COVID-19 pandemic, we had been conducting annual visits to people deprived of liberty in Manila City Jail, providing them with much-needed dermatologic care. This effort was a reminder that access to healthcare is a basic human right, regardless of one's circumstances, and that dignity in care must extend to all members of society. We have also been conducting head lice eradication missions in nearby public schools in Manila. Dr. De Vitas will be providing more details on this initiative later. And during the height of the COVID-19 pandemic, we also launched an information dissemination campaign aimed at educating our fellow healthcare workers on how to protect their skin from PPE-related injuries while still safeguarding themselves against COVID-19. Environmental and community dermatology, along with public health, are closely linked. This was demonstrated over 10 years ago when a dermatologist from our department reported a chronic arsenic poisoning toxicity or a poisoning case in Pampanga, prompting investigations by the National Poison Management and Control Center and the DOH that led to an environmental and community health assessment. We have not forgotten our indigenous communities. In 2022, we served the ITAS in Capas Tarlac, where we treated numerous cases of tinea imbricata. And under the leadership of Dr. Dofitas, we have been revisiting the ITAS in Labo Camarines Norte to monitor and prevent any resurgence of yaws. So we went in 2023, and again this year, she went together with Dr. Batak. During this year's revisit, no active cases of yaws were found. So to the dermatologists we have become today, we owe a big thank you to UPCM.
Thank you for telling us about these projects, Dr. Baras. Personally, I've also been in awe with how our community residents have taken to heart their own advocacies and placed them at the service of the community. Turning to research, Dr. De Fitas, you've seen the evolution of dermatology research firsthand. How has it changed over the years?
Well, would you believe, Tin, that dermatology research in UPPGH dates back over 100 years ago? During the 1920s, when Dr. Perpetuo Gutierrez, a dermatology instructor at the UP College of Medicine, was an expert of yaws, a chronic skin and bone infection prevalent in the Philippines since the Spanish colonial times. He tested the yaws treatment called neo-arsphenamine in Parañaque. He had more yaws research thereafter. When yaws was a great public health problem in this country, in 1922, Dr. Perpetuo Gutierrez accepted the task of conducting a nationwide campaign against yaws. He became the head of the section of dermatology of the Bureau of Health. Together with Dr. Manuel Fernandez Sr., Dr. Gutierrez did studies and publications on venereal diseases, common skin diseases, and infectious diseases up to the 1950s. The son of Dr. Perpetuo Gutierrez, Dr. Guillermo Gutierrez, carried on his legacy in dermatology as our consultant. He had publications and studies about fungal diseases at PGH in the 1980s. We are quite proud of dermatology research at UPPGH then and now. Looking back at our research output since the 1990s, there has been a steady increase with an uptick in 2023. Majority are case reports and observational studies, but interventional studies are increasing. Scientific publications have also been steadily increasing since the 1990s, with a peak in 2024.
Wow, indeed, transformation has been significant in recent years. How about in relation to community service? What innovations have we developed through research, Dr. De Fitas?
um, I'm very proud to say our research innovations and service have been intertwined over the years. Research is translated to practice in dermatology. For example, our validation studies on teledermatology and teletraining proved that this technology enables us to reach the underserved. Through teledermatology, we were able to help rural health physicians diagnose tinea imbricata, a rare lace-like ringworm among indigenous peoples. Due to the pressing need for affordable and accessible antifungals for tinea imbricata, we tested community-produced Acapulco leaf decoction for its treatment. This has been effective and useful. We thought a simple herbal treatment that the indigenous people can sustain. Our dermatology researchers have also tested Acapulco 50% lotion and ointment for pityriasis versicolor, a very common fungal skin infection.
So that should be very close to my heart. It's great to see that these simple remedies are life-changing for a certain population. How about in the school setting? Have you reached that population as well?
Yes. As mentioned earlier, we have developed and validated through randomized controlled trials petroleum jelly scalp occlusion kits for head lice treatment among school children. This Kuto kit suffocates head lice, performs as well as permethrin shampoo. It's easy to use and it's affordable.
Moving on to neglected tropical diseases, what have been significant research contributions of our department?
Now, remember YOS, the public health problem that Dr. Perpetuo Gutierrez was working on in the 1920s?
Yes, yes.
YOS was forgotten actually by the 1970s, then rediscovered through our community surveys in Mindanao and Luzon. YOS is now one of the priority diseases for elimination in our country. Dermatology at UPPGH is once again assisting the Department of Health in the YOS program. Dermatology research has also leveled up for leprosy. We are heading a leprosy antimicrobial resistance molecular surveillance in the country and point-of-care testing for PCR in various referral hospitals in the Philippines.
That's very great to hear. Thank you, Dr. De Fitas. Now, on to training. Dr. Cobillan, seeing our residents. Where are they?
Yes, next slide to show the residents. So now, since we're a department, the department has 28 faculty members, 18 residents in training. So we have 6 per year, 6 first years, 6 second years, 6 third years, 1 chief resident who is a graduate of the residency program, exemplary chosen to serve a post-residency service to the hospital. And we also have 1 dermatopathology fellow per year. Now, our residents in training rotate in the different services and divisions, namely dermatopathology, phototherapy, immunology, dermatologic surgery, contact dermatitis with patch testing, and infectious diseases like what you've seen, including that of leprosy, yaws, or Hansen's diseases. So we do have a Hansen's Club. We have added new services as we expanded, which added to the training of our residents. Namely, next slide, we have the Mohs surgery, which we launched in 2022, but which have been, in 2022. And this Mohs micrographic surgery is the gold standard for treatment of skin cancers, such as basal cell carcinoma and squamous cell carcinoma.
Okay.
In the next slide, we also showed that our laser launch. Next slide, please. In 2023. And next slide. The next slide shows that we have acquired Pico laser, the Picoway laser, CO2 laser, the V-beam pulse dye laser, and we also have an Nd:YAG laser, which is not included in the picture. So with these machines, we're able to treat both our charity and our private patients as well. So we do not only excel in treating our patients, but also the aesthetic part of dermatology as well. New acquisitions for this year are that of the next slide. We have the Excimer laser, which uses targeted narrowband ultraviolet B light to treat various skin conditions such as psoriasis, vitiligo, and atopic dermatitis. And next slide. Just a few weeks ago, next slide, we have the 26 header microscope delivered and installed, which further strengthens our derm path training for our residents. And the next slide, what is exciting for us is our transfer to the multi-specialty building, which will happen next year around August or September. Here we will be occupying almost 10 times our current area. So more space means more room for progress. So exciting time indeed for our department as we continue to pioneer in the field of dermatology. Thank you, Tin.
Exciting times ahead for the UP College of Medicine and PGH Dermatology, indeed. Thank you to our panelists for sharing those valuable perspectives. It's always inspiring to hear different viewpoints on how our specialty continues to evolve. At this point, we open the floor for questions. If you have any queries for our speakers or panelists, please type them in the Q&A box. We'll address as many as time allows. Okay, do I have questions here? So maybe we can, Dr. Kubilian, you gave us a glimpse of how our new home would look like. How do you envision the dermatology in 1.5 years? I heard we will be transferring in 18 months, right?
Yes, so fingers crossed, we'll be transferring next year, second half of next year. So the future of dermatology education, I think, is both technology driven, as we've seen all the equipment, but it also would be deeply human. So on one hand, of course, we have AI, which will help us with diagnostics and digital pathology as well. And we have genomics, especially we have the next gen sequencing that's already been, we had that blessing done in PGH. So with that, we would have more precise and efficient care for our patients, and that we'll incorporate that in our curriculum. But on the other hand, of course, we've seen about the services, the community services, the missions that our department has been doing. So that's the heart of our training. So it must remain patient-centered and community-oriented, because technology, as we know, should enhance, not replace our ability to connect and care for people. So curriculum will be different in a way, but it will be exciting again as we put this into our training for our residents.
Yeah. Okay. What struck me is the mention of AI. I think that's the trend nowadays, and we're going there, and we really do have to be prepared to incorporate that in
Yeah, to incorporate, but
not
not
to
to overcome, not to like
not to be
overwhelm or
overcome by
replace.
AI.
Yes,
Yeah.
yes, yes.
Okay. Okay, so there's a question here for Dr. Paras. Are treatment outcomes for our patients in the community monitored for efficacy? What ways do we have to standardize treatment? What ways to standardize treatment
Yes. Yeah.
data? Sorry, the question. Where is the question? I can't. Can you read it? Wait. All right, there. What ways to standardize treatment can we do to ensure that although we may meet them only once, our impact will be lasting?
Thank you for that Miss Universe question. Yes. Yes, we monitor our treatment outcomes. For example, in our head lice eradication campaign, we return after 1 month to check which school children are completely lice-free. And this year, we also plan to train public school teachers in screening and treatment so that we can extend the program to another school in the coming years. And as for the separate question, our projects are not just confined within the walls of the hospitals. We are doing that already. Take SINAG, for example. We have previously collaborated with MMDA officers and dairy farmers. And in the future, we also plan to screen our other high-risk groups for skin cancers, such as fishermen. We're just looking for a community that is relatively accessible to us coming from Manila. We have many community projects in the pipeline. One is a project that was suggested by Dr. Aruni to partner with TESDA to provide public health lectures on nail disorders for nail technicians, yung mga nagmamanicure, particularly in recognizing signs of nail melanoma, so that they can become our valuable partners in detecting this potentially fatal condition.
Okay, thank you for that. Well, actually, if the flood control projects do not work out, maybe the fishermen might be very accessible in time. Okay, so this one for Dr. Dofitas. Thank you for sharing the research progress of the department. Are there plans to mirror the harmonized research agenda of PGH to the department with different strands, specifically tailored for either a subspecialty or a specific thrust? I
Uh,
hope you understood that.
mhm.
Quite a
Yes,
long question.
yes. There is a UP College of Medicine Philippine General Hospital harmonized research agenda, which was developed around 2 years ago. And the department has actually identified priority research topics also based on the research agenda. And we have narrowed down certain research topics already and even identified project leaders for them. So the question remains, no? Can we really pursue all of these priority research topics? And I believe we have been doing those. We just really need to revisit the research topics and update them because sometimes the change or the needs may change over time, and we will need to uh, adopt other research topics in the future. But yes, we have been actually focusing on, let's say, skin cancers, infectious diseases like the neglected tropical diseases, for example, and of course, development of healthful health technologies for skin problems.
Mhm. Okay, so there's this question for Dr. Maano, but I think everyone can also chime in since everyone's tech savvy. How will artificial intelligence be integrated in the dermatology curriculum and medical curriculum at large for our increasingly technologically savvy student body? Dr. Maano.
I agree with you. The AI seem to be has a pros and cons effect, no? So if we're going to use the AI, we still need a human, body to check it, because they can always say a lot of things in the AI, including that of dermatology, including that in our TikTok vibers that we have. We don't know if those are the real ones that we have. Sometimes our dermatology is presented there. So we still need somebody to screen the AI, not the AI entries that is coming in. No, that's it. It's really a revolutionizing even what we're doing at the moment. We are already being tapped by AI. No, that's it, Tin. I think
Okay, yes, Dr.
human.
Dominguez, anything to add?
Yes, regarding AI tools for research, we have had attended these workshops recently offered by the Medical Informatics Unit, and we do. It's emphasized that we must have responsible use of these AI tools, and also we also have in the Office of Research Integrity at UP Manila already a guidance regarding how the use of AI in our research and publications, example, how to cite them. So indeed, we will be seeing using AI more and more. But I think our students and residents must have guidance from UP Manila, definitely, and from us. We must also learn how to use AI responsibly in order to teach our students and residents and fellows about the proper use. So I think it's just like money. Money per se is not evil, but it's the one who uses it, whether for the good or the bad. So that is the same with AI.
Okay, thank you, Dr. De Fitas and Dr. Maaño. I think we just have time for one more question, and this is for Dr. Kubilian. How have we made sure that we strike a balance between service and training for our residents, still looking to establish a firm grasp of the theoreticals of our specialty?
Well, in terms of the way we designed our curriculum was that for our residents to treat, for them, of course, to know the theoreticals as well as to do to use all of this equipment that we have provided for them already, but also know that like aesthetics is not just only for aesthetics purposes, but also to know when to use them and when not to offer it. So
Mhm.
like right now, especially like for social media, like um everything red, use the V-beam or for pulse dye. But what we're teaching our residents is that you have to know first what you're treating before you do a procedure. So that would be relevant in terms of that. And what we would want to emphasize is that, especially as we transfer to the next building where we have more space, is that to treat both charity and our patients equally with the same level of expertise and with all the equipment that we have. So that's what we also want to teach our residents as well.
Okay. So we've reached the end. Thank you, everyone, for such an engaging and insightful discussion. To show our gratitude, we would like to award certificates to our esteemed speakers. First, to it's still thinking, it's loading. Okay. I think Nando has brought it with him. All right, so certificates for Dr. Clarita Maaño, our speakers, Dr. Clarita Maaño, Dr. Yes, here we go again. Dr. Dayan Paras, Dr. Belen Dufitas, and Dr. Eileen Cobillan. They're there, even if you,
Yes, we're sure that they're there.
I assure you, they were
You.
there a while ago.
Thank you.
Okay, so we're now down to our final segment. They're trying again. Okay, see, they're there.
Thank you.
But
I just renewed
yeah,
my
this is
PRC
for
license a while ago using, because we have this PRC caravan right now ongoing in
yes,
PGH
yes,
8th
yes.
floor. So we really do need the certificates. So
Okay.
If you approve.
Okay, so there for Dr. Defitas, for me as well. I have a certificate. Okay, so we're now down to our final segment. To officially close our webinar, we invite Dr. Claudine Yap Silva, the training officer of the Department of Dermatology, to deliver the closing remarks.
Good afternoon, everyone. As we come to the close of today's program, let us take a moment to reflect on what has been accomplished over the past years and how far we have come in the evolution of teaching and learning in dermatology. We have seen how our approach has shifted from traditional lectures to more patient centered blended learning models. Through small group discussions, OSCEs, simulations, the LU5 self instructional module, Atlas of Philippine Dermatology, and student created patient education videos, we have made learning more interactive, practical, and meaningful. Today, we also highlighted how our department continues to expand in service, research, and training. From community programs like Tutok Buhok, Sinag, Aruga, and the relevant, impactful research, as well as advances in dermatologic surgery and laser technology, all of these reflect our commitment to innovation while staying rooted in our mission to serve. We all know that the journey of learning is continuous. And as we look forward, may we all remain dedicated in advancing education, adapting to change, and ensuring that our work always aligns with the needs of our patients and the health of our nation. Thank you to our speakers, panelists, and participants for making this exchange truly meaningful. Happy 120th founding anniversary, UP College of Medicine.
On behalf of the UP College of Medicine and the UPPGH Department of Dermatology, thank you all for joining us today. We hope this session has given you fresh insights on how dermatology education continues to evolve in response to the changing medical landscape. Have a bright and hopefully sunlit day, everyone.